Hello, this is Faye, and I would like to just welcome you to Medicare and Social Security 101. This presentation is all about you. I am so happy that you were able to attend today. The weather is beautiful. It's a great day to be out, and thank you so much for spending just a few moments with me. I have been actually involved in Medicare business for more than 20 years, and I'm actually a card-toting, red, white, and blue card-toting Medicare beneficiary. So some of these things I know very well from experience personally, and others I know that I've learned over the 20 years that I've been in the business. Medicare actually is confusing. There are a lot of questions around Medicare and what does it mean? And over the years, I've heard people say, oh, when I get Medicare, I'll be all set. I won't have to pay so much or have so much deducted from my pay. I'll have health insurance and I won't have to worry about it. When I get 65, that's just going to take care of it. Well, as I told you, Medicare is confusing. But what I want to do today is take that confusion out of Medicare and answer your questions in simple, plain language. Let me tell you, before we go any further, I am not employed by Medicare. I'm not employed by the Social Security Administration. I'm not employed by any governmental entity. I have my own brokerage firm. It's F.S. Horton Insurance Professionals, LLC. So don't confuse the fact that I may be working for Medicare, because I'm not. I'm simply here to answer your questions. And if I don't know the answer, I will research and find the answer for you. So these are the things that we're going to cover in this presentation. What is Medicare? You'll have a clear understanding of exactly what Medicare is, and it's not the hype that you may think it is. There's a very simple explanation. Who is eligible for Medicare? There are actually 4 different eligibility requirements for Medicare. When to apply, but I'm also going to tell you not only when to apply for Medicare, but where you should go to apply for Medicare, how you're going to go about applying for Medicare. And then the real confusing part, the Medicare benefit options. We're going to cover those. And at the very end of this meeting, we're going to talk about the role very briefly now, because this meeting basically is so that you have a better understanding of Medicare and how Medicare works. But at the very end, we'll talk a little bit about the role of Social Security in retirement planning. How many of you have received already your Medicare and You Handbook? The Medicare and You Handbook is sent to Medicare beneficiaries every year. Every year the book comes out, and in the very back of the book are the plans that are in your area. And Medicare Advantage plans, as well as prescription drug plans, are listed so that you can compare plans to have a better idea of what might work for you. So everybody gets a Medicare and You Handbook. If you don't get it, you can download it from, just go to Google. Google is your friend, and type in Medicare and You 2022 and you can download the handbook so that you can have it digitally anytime you need to search for an answer. Our first topic now, in the handouts that you have the questions and the topics that we're going to cover. So the first one is, what is Medicare? Medicare is a federal health insurance program, and who has Medicare or who's eligible for Medicare is the next topic, and that would be people who are age 65 or older, people who are not age 65, but who are disabled and receiving Social Security benefit payments for 24 months, people who have end-stage renal disease, and people who have been diagnosed with ALS, commonly called Lou Gehrig's disease. Those are the people who will be eligible for Medicare. When you actually become eligible for Medicare, you'll receive a red, white, and blue card that looks very simple to this sample, very similar to this sample card. The original Medicare card looks exactly like this. Previously, the Medicare number was your Social Security number or the Social Security number of a spouse from whom you were receiving Medicare benefits. Well, those numbers have changed, and now Medicare actually assigns a Medicare number to every person who becomes eligible for Medicare. And your card will identify the date that you first become eligible for Medicare Part A and the date that you accept Part B. When should you apply for Medicare? If you're receiving Social Security benefits, then you should automatically receive information about that red, white, and blue card, the original Medicare. And you would get that at least 3 months prior to your birth month. Or since you're receiving the Social Security benefits because you are disabled, you would receive it about 3 months prior to the eligibility date for Medicare, which would be the first of the month of the 25th month of receiving those disability payments. If you're not receiving Social Security benefits, you may still be working and not receiving Social Security benefits. You may not be working at age 65, but have decided that you're not going to collect Social Security until your full Social Security retirement date, which differs based on when your birthday might be. You need to apply for Medicare benefits 3 months prior to your birth month of turning 65. So even though you're still working, 3 months before your birth month of 65 is when you should reach out and start to get answers about what's going to be better for you, the individual. Now, before I go any further, let me just say that people often ask other people, what did you do? Often we do what our friends may have done, or our family, or you may remember what your mom did or your dad did with Medicare. You may even know what your spouse did if the spouse became 65 before you became 65. But Medicare is an individual benefit. So how you choose to use your Medicare benefits could be different for each individual. How do you apply? The easiest and most least complicated way right now to apply is to set up a Social Security account at ssa.gov and apply for Medicare online. The Medicare offices, since COVID and the pandemic, many of them have been closed. Many of them do not do appointments that for people who are approaching 65, so that they are not open for the public. And so this easiest way right now would be to do an online application. You can also call the Social Security Administration. Even though this is Medicare, it's done through the Social Security Administration. So you can call Social Security and set a phone appointment to apply. You can also call the Social Security office and see if it's possible that you can have a person-to-person, an in-office appointment. Now let's get into the parts of Medicare. There is Part A, Part B, Part C, Part D. You probably have heard about all those alphabets, but let's kind of talk a little bit about each of the parts and what those benefits mean to you. So Part A is hospital insurance. Hospital insurance covers inpatient hospital care, skilled nursing facility care, hospice care, and home health care. Inpatient hospital care is not going to be covered by Medicare at 100%. Skilled nursing is not going to be covered 100% in its entirety. Hospice care is covered, and home health care is covered without coinsurance and deductibles from you. Part B of Medicare, Original Medicare, helps to cover doctors and other healthcare providers, all of your outpatient care, such as x-rays, lab work, durable medical equipment, which would be canes, walkers, wheelchairs, oxygen, and Part B covers your preventive services. Preventive services are covered without deductibles and coinsurance for you. The other Part B expenses do have deductibles and coinsurances for you. Part D is your prescription drug benefit. So the Medicare Part D plans are offered by private insurance companies that follow the rules of Medicare. And each of the prescription drug standalone plans that's offered must be approved by Medicare. So insurance companies don't just jump up and decide this is the plan I'm going to have. And if there is something that's not on the formulary, there are other alternatives that are required in a standalone prescription drug plan that Medicare requires, that they have something that will cover any situation for you. Supplemental coverage is not a part of Original Medicare. When you look at that red, white, and blue card, it says Part A and Part B. So supplemental coverage is just that. It's supplemental to Parts A and Parts B, where there are deductibles and coinsurance that you would need to pay, you could purchase what's called a Medigap or a Medicare supplement plan, also known as the alphabet plans, to cover those out-of-pocket expenses for you. And if you're turning 65 at this point, the plan that covers most of those expenses would be the plan letter G. G for good. All Medicare supplement plans, no matter where you get that plan G, if you bought it from an insurance carrier in Wyoming, if you got it from an insurance carrier here in Florida, you got it from an insurance company in Ohio, no matter where you buy that Plan G supplemental plan, the benefits are going to be the same. Now, supplemental plans are offered by private insurers, so the premium that you pay for a supplemental plan is paid directly to an insurance company that has been approved by the state insurance commissioner to offer those supplemental plans in your state or in your area. So the insurance company chooses the plans that they're going to offer. They may not offer all of the Medigap plans that are available in certain areas, but the ones that are available, those are the ones that you have a choice to purchase. And the reason you're purchasing supplemental coverage is to cover the deductibles and the coinsurance that you may incur with using original Medicare. Are we clear so far? I like to go through the entire presentation and then take questions at the end. Make sure that you write your notes down and keep your questions, ready so that I can answer them. But I'm probably going to answer most of your questions once I go through the entire presentation. So you have some choices. You could do just original Medicare, A and B, which means you would have no prescription drug coverage and you would have no supplemental coverage. So all of the out-of-pocket costs, which is not capped, that would come with the deductibles and coinsurance from original Medicare, you would pay out of pocket. You could also choose to do the Medicare, original Medicare A and B, and add the Part D plan. And you could have a full comprehensive program with Medicare A, Medicare B, a supplement that picks up the gaps that are missing to those pieces, and a Part D plan. You will have premiums that you will pay for Part B Medicare. You will have a premium for the supplemental plan, and you'll have a premium for the standalone Part D plan. Now, if you're using original Medicare, you should know that you can use any provider in the United States that accepts Medicare. Medicare covers you throughout the United States. So there are no networks with original Medicare, and the benefits will travel with you wherever you are. If you do not accept Part B, when you are first eligible for Part B, unless, of course, you have coverage through your employer plan, and you can supply proof of that coverage from the time you became 65 to the time that you decide that you want original Part B, you will have a penalty if you do not have those things in place. You will also incur a penalty for Part D, the prescription drug piece, if you do not take that when you first become eligible. And you can become eligible for a Part D plan even if you do not have Part B. If you only have Part A, you can have a standalone prescription drug plan. So it's really important. Make note, mental note, and make note on your papers that to avoid penalties, you always want to accept Part B and Part D when you first become eligible. Now, some of the cost of Medicare benefits, and this is for 2022. Just to give you an idea and an overview, I've already told you you have premiums. I've told you that you have deductibles and coinsurance. So you know that you can have out-of-pocket cost. So Part A of Medicare could cost you, the Medicare beneficiary, $0 to $499 a month. If you've worked and you've paid into Medicare for 40 quarters, doesn't have to be consecutively, could be any time during your lifetime, you've paid in for 10 years, then you have no premium for Medicare Part A. If you have 30 quarters that you paid in, then your premium for Part A is somewhat less than $499 a month. But if you have no quarters and you need to purchase Part A, the full purchase price for 2022 is $499 a month. For Part B, the standard premium for Medicare Part B is $170.60 per month. So when you choose Part B, if let's say that your birth month is April 1st, you have Parts A and B, then you will start to pay $170.60 per month for the Medicare Part B. The monthly premiums for the supplement varies by company, varies by area, and premiums are based on gender, age, tobacco use, and where you live. The range for someone who is turning 65 now in 2022 for a Medicare supplement plan is $130 to $230, and that's for someone right at age 65. The older you are, because they're age rated, the premiums could be higher. The Part D premiums, monthly premiums for Part D, again, since they're provided by private insurers, they're approved by Medicare, but the plans are provided by private insurers. The premiums range from $7 a month to $102 a month. This is just to give you an idea of what your cost for premiums would be. This chart just kind of tells you if your modified adjusted gross income per household, and if you're filing individual or if you're filing joint taxes, your premium for Part B could be greater based on what that modified adjusted gross income is. For most people, it will be at the 170/10, but it could certainly be higher, as you can see. So you're thoroughly confused now? I hope that I have not confused you too much. We're going to do a summary at the end, and I'll answer questions. We'll have open questions, And also, we're now going to look at the other option, and that is the Part C. Part C is a Medicare Advantage plan. Medicare Advantage plans are approved by Medicare. They're offered by private insurers. You must have Medicare Parts A and B in order to have a Medicare Advantage plan. And Medicare Advantage plans are offered differently in different areas, different zip codes, different counties, different states. There are major insurers who offer plans nationally, but they don't offer the same plans in every state. The private insurers submit their plans to Medicare annually, so the plans are approved before they're put on the street for you to even look at. And within the Medicare Advantage plan, you have choices. You have choices of an HMO, which is a health maintenance organization. You have choices of a PPO, preferred provider organization, or PFFS, private fee for service. There are also SNP plans, special needs plans, which could be chronic special needs, could be institutional special needs, could be dual special needs, which would be for people who have Medicare and Medicaid. Then there are also the Medicare savings accounts that are offered in some areas. And Medicare Advantage plans can be with prescription drugs or without prescription drugs. So they can be MAPD or just MA plans. Now, Medicare Advantage plans differ from using original Medicare, because the Medicare Advantage plan is going to cover the benefits of Medicare Part A, Medicare Part B, and often Medicare Part D, all in one plan. So there's no need for a supplement because the plans are delivered, the benefits are delivered to you differently than they are with original Medicare. Hospice is covered by original Medicare, so that's not a piece of the Medicare Advantage plan, but all of the other benefits of original Medicare must be covered in the Medicare Advantage plan. So Medicare Advantage plans also can offer some additional benefits that are not offered by original Medicare, like the fitness centers, the hearing benefits, the dental benefits, the vision benefits. The Medicare Advantage plans must follow Medicare rules. So if a screening for diabetes is covered under original Medicare, then the screening for diabetes is covered in the Medicare Advantage plan. The benefits may be delivered differently, but it must be covered. Each year during the annual enrollment period, you've heard people talk about AEP, which is October 15th to December 7th. You should review how you're receiving Medicare benefits, and you have the opportunity to change. Everyone who has Medicare can change their benefits during the annual enrollment period. Now, you may have an option to change other than at the annual enrollment period, and that would be during either the open enrollment period, which is January 1 to March 31st. During that time, anyone who has a Medicare Advantage plan can change plans. And you could have a special enrollment. You move from one area to another. You become eligible for Medicaid. Different, you have a chronic illness. So those are some of the ideas that where you might fit a special enrollment period. So let's kind of go back over what we've talked about and see if it's been somewhat clear for you. So what is Medicare? It's a federally sponsored health insurance, plain and simple. Who's eligible? People who turn 65, people who are under 65 but disabled and collect Social Security disability payments for 24 months, people who have been diagnosed with ALS or end-stage renal disease. When should you apply? 3 months before your eligibility month. 3 months before you turn 65, 3 months before your 25th check from Social Security if you are disabled and under 65. For Lou Gehrig's and end-stage renal disease, there are no waiting periods. So Medicare tends to notify people right away when they have those diagnoses. How to apply? You should start with ssa.gov. That's your first source. It can be frustrating on the phone, so start trying to do an online application well in advance so that you have everything that you need and you're not waiting till the last minute. The benefit options, few benefits of original Medicare are without deductibles, coinsurance, and there's no maximum out of pocket for original Medicare. So there's no cap on what you might spend out of pocket for those deductibles and coinsurance. The parts of Medicare are Part A, which is hospital, Part B, medical, Part D, prescription drug. The cost of Medicare includes premiums for Part B, premiums for Part D, and if you choose a supplemental plan or a Medigap plan, you'll have a premium for that. The option 2 in Medicare benefits and receiving Medicare benefits would be Medicare Advantage plans. And the Medicare Advantage plans includes the benefits of both Part A and B, and often includes the Part D all into one plan. Medicare Advantage plans are offered by private insurance companies. So you get to choose the company that you want to work with. The Medicare Advantage plans will have lower premium cost for you. And they may include those additional benefits, the dental, vision, hearing, the over-the-counter products, the fitness center. However, the Medicare Advantage plans must follow Medicare rules. So you look carefully at what plan, what option will work better for you. And each decision is an individual's decision. Now, Social Security is officially the Old Age Survivors and Disability Insurance Program. It's a comprehensive federal benefits program designed to partially replace income for retirees, their spouses, those whose spouse or qualifies ex-spouse who have died, and people who are disabled. Social Security, you can start to receive benefits at age 62, or you can start to receive benefits if you're disabled or blind, if you have enough work credits. Family members can qualify for Social Security based on other family members' work history. Eligibility for Social Security payments differ from eligibility for Medicare. And that's why this little segment is added to the presentation today. You can start to collect Social Security at 62 if you have the proper work history. But unless you're disabled, you cannot collect Medicare until 65. When you become 65, you do not have to collect Social Security if that is not your full Social Security age. Your full Social Security benefit is based on age. You can find that out from the Social Security Administration. And you can collect Medicare or become eligible to have Medicare at age 65 and start to collect Social Security later, like 66 or 65 and 66 in 2 months, 66 in 3 months, based on when your birth month is. Are there any questions? Thank you so much. There's one question in the back of the room about the amount of the Part B premium. Medicare Part B premium for 2022, and I really didn't see the need of going back over history, and I can't go in the future because I don't have my crystal ball, but Medicare sets that premium every year. And for 2022, it's the standard is $170. It can be greater based on your modified adjusted gross income. Thank you for that question. Are there any other questions? You've taken copious notes. I don't know who you are. You know who I am. So I'm going to say to you, if you need additional information, if you want to actually look at what might work best for you as an individual, then by all means, come up, set an appointment with me. I'll be happy to share with you anything else that I can. Thank you so much once again for attending this presentation.